Hi, my name is Greg Martin. I am a physician at RIA Endovascular. We are a group of interventional radiologists located in the Denver Technology Center in the Centrum building. Today I'd like to talk to you about treatment of venous varicosities and venous disease, and what to expect when you come here for a procedure. When you come to RIA Endovascular for treatment of your varicose veins, there are several things that you should expect. If it's your initial procedure, most likely you will be undergoing something called an ablation. Ablations are a surgery that is used to treat the major superficial veins in your leg. Things that you should know when you come for this treatment is, number one, make sure you bring your compression stocking. That is a very important aspect of the procedure. Also important to know is that we have options for your comfort during the procedure, including oral sedation. That generally, for most people, helps them during the procedure and takes away some of the anxiety related to the procedure. The procedure is done by the physician who is there during the day and also a medical assistant. The medical assistant will clean your entire leg that we are treating and allow us to be able to visualize all the veins that need to be treated during your visit. The physician will then, utilizing ultrasound, map the veins in your legs and seeing which ones need to be treated and which ones do not. During an ablation, what you will experience is multiple injections into the skin to allow us to anesthetize the skin so you do not feel the ablation itself. I'd say that most patients say this is the most uncomfortable portion of the procedure, but generally it is very well tolerated. When the procedure is completed, the medical assistant will clean off your leg and then will apply the compression stocking. It is very important that you wear the compression stocking as instructed. Generally, you will leave the compression stocking on for 2 days without taking it off, and then we'll wear the compression stocking for 2 weeks during the day. It's very important for you to walk around and to continue to have the blood flowing within your leg. We recommend a 20-minute walk at least once a day while you recover from the procedure. This will also help with some of the post-procedure swelling and discomfort. You can also take ibuprofen to help with some of the inflammation after an ablation. After an ablation, you will have a follow-up with the nurse practitioner 1 week after the procedure to make sure that you are doing well. If you have severe pain or any other concerns, please don't hesitate to reach out to the clinic, and you don't have to wait for your 1 week visit if something really concerns you. Another procedure that you may receive in our clinic is something called foam sclerotherapy. Oftentimes, approximately 1 month after the main ablation, you will return to clinic for treatment of the other superficial varicose veins. This procedure is less involved than the initial ablation, but it's very important to treat all the varicose veins in your legs that are causing your symptoms. What you'll experience that day is we will clean off the areas of your leg that we are going to treat. We will access the veins with a very small needle and then inject a chemical that will help get rid of those veins. Again, compression stocking use is very important after this procedure, as the compression stocking helps compress the veins and allows the foam to do its job. A special note about foam sclerotherapy is that if you have a focal area after sclerotherapy that is painful to the touch, is firm, this may represent a small collection of what's called trapped blood. If this continues to bother you, we do have the option to do what's called an aspiration approximately 10 days after your foam sclerotherapy. That can greatly assist with some of the discomfort. Now, you can be reassured that if you do not have the aspiration, the discomfort will improve significantly over time. And again, I recommend ibuprofen for any sort of discomfort you have after foam sclerotherapy. If you feel like this treatment may be helpful for you, the symptoms that you may experience if you have venous disease could be chronic leg swelling, could be heaviness in the legs, could be fatigue, could be restless leg syndrome. And in severe cases, you may have a sore or wound that just is not healing. If that's the case, please reach out to us. Our clinic number is 720-493-3406. Thanks.